Okay, so here's my final report about my Atlantis Pre-Medical Fellowship shadowing in Pontevedra, Spain. I decided to make it into a PowerPoint, so I hope you all enjoy.
Here's the overview of the presentation. So, a few things. I'm going to go in more depth when talking about the arrival, volunteering, the note to a special patient there, as well as when I reflect about my entire experience. But with the rotations, I'm going to do kind of a brief summary about my department that week, and then I'll show some pictures illustrating that, as well as some schematics from a notebook that I kept to record these. And same for free time. I'm gonna do kind of a brief overview, explain kind of the places I went, and then I'll let you guys have some pictures. But yeah, I know there are a lot of pictures here, a lot of slides, so I'll try to keep it brief, but please bear with me. Thanks. So first, my arrival. I included this section in my presentation because, well, it kind of reminded me of the book The Alchemist by Paulo Coelho. There's this young guy, Santiago, who's on his personal legend, so to speak, kind of exploring the world out there, exploring himself. And throughout this journey, he keeps receiving these omens of good faith and, just instances of reassurance that, he's on the right path. And it's weird, I kind of felt that as even on this arrival, my flights there. So I'm going to tell you about a few of those experiences very briefly. So on my longest flight from Philadelphia to Madrid, I was in the middle row on the outside. And on the left row, there are these two older ladies on the outside, and somehow we started talking. I forget exactly how it started, but we casually started talking about, like, oh, what are you guys here for, Then they asked me, what am I here for? I was kind of explaining to them about my fellowship. And just had a lot of great, positive things to say, just a lot of positive energy there. And I was telling them about, they were asking about my career aspirations, and I was telling them how I hope to pursue an MD, PhD, and one of them said their sons did the same thing, was telling me about it, and also just dropping some, some hints about life advice. And, they're the ones who actually took this picture. They're like, come on, let us take a picture to show your mom. And so it was kind of cute. And even the lady beside me, we started talking at some point. I think it's after the wine came, honestly. But she was kind of telling me about that she was on her way to India. And again, she asked me, about my career and what I was doing in Spain. And, she just had a lot of good, good wishes to give me, and, saying like, you're going to do great. You're going to have a great time there. And it's just really beautiful. Excuse my phone. And also on the flight after this, on my way actually to the airport at Madrid to go to Vigo. So at Madrid, I was wearing my UNC shirt. So there was another lady who actually does research in sports medicine, and she saw my shirt. She knew someone at UNC in that department. She was actually on going to a bike tour in France, which is cool. And she was telling me, we were kind of talking again about my career, what she does, and she was asking me, have you heard of this program called an MD PhD? And so I was like, yes. And we started talking, and she actually was on the admissions committee for that at the school she does research at. So she was kind of telling me, when during your interview you say this, say that, this and that. And so it was really, just really nice. And then I'll tell you about the last experience on my flight from Madrid to Vigo. When we were actually on the flight, I was on the left row on the inside, and there's kind of this older gentleman beside me, and I was kind of in my seat just studying Spanish. I have this, Let's Talk Spanish Basics book from Barnes & Noble, and I was kind of just practicing to myself, and I know he kept looking over, and it seemed like he was really interested. I know it can be kind of awkward, asking like, hey, like, what are you doing, especially if you don't speak English. He didn't speak English really at all. And so I tried to ask him, I just turned to him and said, hey, like, can you help me with this? And as best as Spanish as I could. So it was a great learning experience. I mean, we were talking, he was telling me where to eat, where to go, things to do this. And, the whole plane just kind of lit up. They were laughing, probably at my broken Spanish, but actually the gentleman beside him, he spoke a little bit of English, so he kind of chimed in and was kind of helping us just kind of mediate conversation. It was a really beautiful experience. And even when we got off the flight, we were saying goodbye, and he's from Vigo, and so I'll touch on this a bit throughout the presentation, but just the culture, kind of embracing, and you treat people you meet like family, and you just definitely got that vibe from him. Hugs, hugging and sit before you say goodbye, and it was just a beautiful thing. So yeah. Hospital Montecelo. So this is where we did our shadowing. I'm going to give a very brief overview just about how our days kind of looked with this shadowing schedule. And then I'm going to show you the notebook I used to record what I saw regards to surgeries, consultations, etc. Because I actually used it to help illustrate some of the things I'm going to talk about. And I'm not going to go about them too in depth as they are in the notebook, but hopefully you'll be able to see at least what I'm talking about. Here's all the fellows. So there were 12 of us total. As you can see, I'm the only guy there. The program coordinator was telling me that's very common for this fellowship. There tend to be a lot more women than men. In the middle, you can see our hospital coordinator, Dr. Adolfo Baloira. We actually became really close during pulmonology. I'll talk about that a little bit later. But typically what our days look like, you go to breakfast at 7, maybe drink some coffee, have some bread, kiwi. Typically breakfast isn't cooked in Spain. I'm sure it's the case for most of Europe. So it's a quick breakfast, leave at 7:15 to go to the bus, and then you're shadowing from about 8 to 2. Maybe you leave a little later, you have surgeries, maybe a little earlier if you're whoever you're with is done earlier. So I'm gonna go ahead and show the notebook that I use to record these surgeries, consultations. And it's important because I use it in this presentation to kind of illustrate the things I'm talking about. I'm not going to go as in-depth as my notebook, but hopefully you'll at least be able to see what I'm trying to explain. Here's the notebook. Again, I mainly just use it to record what I saw in my surgeries. I tried to ask what was going on as best I could in Spanish, but they were amazing staff. There was definitely a language barrier, but again, that's expected. And if we couldn't kind of figure out what it was with talking, they would even go through the length of drawing it out for me or pointing to the x-ray and saying, here's this, this is the fracture, etc. So just an amazing staff. Again, I use some of these illustrations throughout my PowerPoint, so you're going to see some of those. My first week was in the pulmonology department. I'm not sure if I explained it earlier, but essentially each week we're given different departments. Sometimes you'll be with more than one person. It's usually no more than 2 people together in the program. But each week each of us had a different department. Here I am with the pulmonology department. Well, at least 3 of them. On the left side, you'll see Dr. Adolfo again. He's actually the person I was shadowing with, that we went to consult people with. I was with him essentially the whole time. But in the back, we see Dr. Nagore beside him, and beside me is Christian. And because his name is also Christian, we all kind of joked. They'd be like, oh, there goes Chris the first. And they would call me Chris the second. But I'm like, no, like, soy el mejor Cristiano. And so, we just kind of always had that joking, fun vibe between us all. And it was like that all the time. So what a typical day looked like for me in this department. So Dr. Adolfo told me to come at 9. We all kind of meet in the cafeteria. Us 4 usually would be there with a few other people in other departments. And so we would be there, have coffee, have a croissant. Time was very fluid. I think that's the best word to say. And it was kind of like that, honestly, I feel like for Spain as a whole. You just kind of went with it. There was no really structured time, like, oh, we need to be out of here by 9:30, things like that. And our program coordinator was kind of explaining that to us, like, if your doctor says, hey, I'll be back in 5 minutes, they very well might be back in 30 minutes, but that's just kind of how it is. That's just how time is there. So that was pretty nice as well. I actually really enjoyed it. But after we ate, we would go to his office. There we would look at all the patients we had for the day. We'd look at their history, any scans, and then from there we would go consult. And I always thought that going to medicine, I'd want to be a cardiovascular surgeon. But this is the one experience that has me contemplating, because I loved the patient interaction. It was just a beautiful thing to be there, especially with a doctor like Adolfo, who he introduces you, this is a student, he would always say, hey, this is the best doctor from North Carolina. And of course I would follow up saying, no, I'm a student here, studying. But it was just kind of that environment, we just kind of, everyone's fed off everyone's energy, and even talking to the patients, there's certain pleasantries I would try to learn the more comfortable I got, just because you can always use your body language to, I guess, show people you care. But I feel like it just kind of brings a new level of care when they see that you're trying to, learn their language so you can communicate to them better. And I think that's a very important thing, because you're a nice person, a nice heart. You want to be able to express, how you usually communicate. So you learn the language. And so certain pleasantries like, fue un placer conocerlos, just, saying it's a pleasure to meet you all. And it was really great. It was like that pretty much every day. We'd see the same patients. I would see them through their health, through their treatment, and it was a really nice experience. Some of the things you'll see in the slides coming up, there's a bronchoscopy, which is probably the closest thing to like invasive. You use a bronchovideoscope through the nasal passages, and you're able to see, it goes down the bronchus, you're able to see, I guess, say a hemorrhage or something of that sort. You have a patient who's coughing up blood, that's what you would use to identify where the hemorrhage is so you can stop it. Other patients may have, pleural effusion or excessive fluid. You can use that. It also has a suction to suck up that mucus. So it's a pretty nifty device. Dr. Adolfo is very skilled, and so it's kind of amazing seeing him navigate his way through their lungs that way. You'll see the nurses. There's Nurse Mercedes, Nurse Lolo, Nurse Raquel, who kind of talked to me about sleep apnea, showed me a CPAP machine that you're going to see in these photos. It was a great time. Dr. Adolfo and I, we'd always, we joke with one another and talk, and, he was saying, he was going on vacation my last week there. He's like, if you want, you can take a boat. You can come on my boat with me and my family. We can go to Sancho, and, I met also the patient there that I'm going to talk about later. I met her there as well, and that was just an emotional experience altogether. And so I give you Pulmonology, and I hope you enjoy the photos that come from it. So week 2, I was in traumatology. This is my first surgery rotation. Traumatology in Pontevedra is essentially the equivalent of orthopedics here. You're going to see a lot of bone operations. And so in these next few pictures, you're going to see me with the surgeons. There's Surgeon Joseph, Surgeon Pablo. 2 of the residents there were kind of the people I was with the first day, Jacob and Miguel. But with surgery, it's kind of, they'll tell you which rooms that your department is working in, the operating rooms, and so you scrub out and you just go to whichever one essentially you want to. And so they were telling me, like, hey, this surgery is going to be more interesting than the one I'm working, go to that one. That's something like Jacob would say. So and again, as throughout Spain, you kind of get this I guess this language barrier, but at this point I've been practicing more on how to speak, how to ask questions, etc. And I actually really love the fact that there was a language barrier, because it forces you to have to learn the language to speak. And even if I can only speak a little better than when I left the States, probably because I wasn't with the host family. Like, we were all living together in a dorm with each other, and we all spoke Spanish. But it was still great, to learn certain things like that. Um, but again, with these operations, you're gonna see also there's a picture of me and Surgeon Laura who did a knee replacement. You're gonna see those pictures afterwards, and the knee replacement is, oh my gosh, you hear it and you don't even realize how brutal it is until you see it. It's very. Dr. Adolfo was joking when I was in pulmonology the week before about, oh, they bet you, if all you need is like a sledgehammer, you can go to traumatology. And I found out there's some truth in a jokingly way. They're just banging at the knee with a hammer and like sawing it, and that's the operation. That's what you're supposed to do. But like, bone actually like flew in my notebook. I wrote it in my notebook, drew a little circle around it. Like, bone flew right here. So it was really intense, but really interesting to watch. I show some schematics. You're gonna see one of the first ones was a graft, and what is really interesting about it is that the FDA apparently in Europe, they don't allow them to use human grafts, so they actually use a pig graft for a rotator cuff, and it was very intricate. Very few surgeons at that hospital are able to perform this surgery, so it was a pleasure to see that. And one of the other drawings you'll see was actually Miguel drew it with kind of the bone and the glavel. We were kind of talking about the operation. I wasn't understanding completely, so he drew a diagram for me, which was really cool. Again, like I was saying, the staff, like, they're really, really great. They really want you to understand, and I would always tell them, hey, it's a pleasure to be here. Thank you so much. And they always be like, no, it's a pleasure to have you. Like, it's just that type of environment. You're going to see too, there's some fractures, femoral fractures that you'll see, hopefully in some of the schematics. So yeah, that's essentially what traumatology was. I didn't explain this while explaining the overview of my week in traumatology, but that week, our fellows were also put in the city newspaper. And not to mention, myself and my friend Misty in the program, our program coordinator asked if we'd be comfortable with interviewing with these reporters. So we kind of said our spiel about, how our time here has been, how we're bringing what we've brought from the United States to here, what we've learned from here. And so they kind of captured the gist of what we're saying in the newspaper. I posted a slide too where you can see where they put from my section. I translated to English as well. So please feel free to read that and enjoy. So the third week, I was in urology. It was an amazing department. I'm not gonna lie, it's not for the weak-hearted. It was a little cringy, some of the surgeries, but overall it was incredible. In these pictures, you're gonna see me with Surgeon Andrea. There's a nurse, I forget her name, but she was in almost all the surgeries I was in. With the male surgeons, on the left is Surgeon Tera, and on the right is Surgeon Luriba. And what's so special about Surgeon Rudy Bell is he's known as being the best urologist in all of Europe, if not all the world. And not only did my program coordinator tell me this, but the rest of the hospital staff, whenever they asked what department I had next, if I said urology, they'd be like, we have the best. And it's true. There in Spain, only at this hospital can they perform certain surgeries because he's there. So it was just incredible to watch him work. And so a few of the surgeries, at least the one that was kind of cringy, was the removal of, I guess, a phimosis. And what that is essentially you have a patient, they're older, and their foreskin is still tight. Now, with children, they tend to have tight foreskin, but over time this goes away. But if it persists, you can't pull your foreskin back behind your penis. It makes you more prone to infection, bleeding of the foreskin, painful urination. So it ultimately has to be removed. So removing this was just hard to watch because it was local anesthesia. So the patient would feel it sometimes when they would cut, and he would like shout like "ow," and like it just makes you cringe. It's like, oh no, they should not feel that. But with local anesthesia, they only give you more. They see that you need it. So in order to see that you need it, you have to express that you're in pain. So that was a little hard to watch, but the rest of the surgeries were amazing. I saw a prostate removal, bladder removal. I believe I have a schematic there of there were conjoined kidneys, and not only were they conjoined, but the right kidney was actually cancerous. So he had to separate it and also remove the entire right kidney. And this was a very complex surgery because the thing of the kidneys, they filter our blood. They're very vascular. They bleed a lot. So you have to go through every single artery you see. You have to clamp it, then you cut it, and then you cut the veins because, the arteries, they bring blood to our body. Veins take it to the heart. You cut a vein first, that blood is just going to spew out. So that's why it's important to cut the arteries first. So that's some of the things you'll see, hopefully, with my drawings there. I know they don't go too in depth, but hopefully you can kind of just get a sense of the operations that happen in this department. So my 4th week, I was in vascular surgery. I was really excited for these surgeries because that's something I thought I've always wanted to go into. So I was really excited going in. But as always, the staff was amazing. In the next picture, you'll probably see me with Surgeon Hugo, Surgeon Julia, the nurses Lorenzo and Melissa. Not future, but were also very important. Surgeons that I saw were Surgeon Carla. And I know there's one other, I forget their name at the moment, but overall just an amazing staff. There, a lot of what I saw was mostly, I guess, occlusions, so pulling out plaques, things of that sort. But it was really interesting. Seeing arteries exposed like that, it's kind of cool. And they also use this really cool catheter called a balloon catheter, and essentially you put it in, I believe I have a schematic of it, but you put it in uninflated. If you have a hard plaque that won't come out, and once you get past the plaque, you inflate it. You essentially have a syringe where you push saline in there and inflates the balloon, and it fills the diameter of the artery. And so when you pull that out, you also pull out the plaque. And again, they were really helpful with explaining the surgeries. I would try to, use my Spanish, practice as much as I could, and eventually we were able to understand each other, what I was asking. And as you'll see in, I believe, the last picture I have of this department, one of them actually drew out a surgery. I believe it was an older lady who had an occlusion in her mesenteric artery. So it was a really extensive surgery, really incredible to watch. And he was very helpful. While explaining, he actually just decided to draw it out for me on my paper, and it was really cool. So I learned a great deal here. You'll see in the first picture, I kind of drew the glasses they wear, which are pretty cool. I learned a lot in this one, especially with the last few surgeries. They're doing hemodialysis as well, and just kind of explaining to me the different routes for kidney failure, your different options essentially. And they, they're just really, I guess, engaging. As I can say for most of the others as well, it was just a really engaging experience. And so, as always, it was a pleasure to be in this department as well.
Flying overhead, shining down. Birds flying overhead, shining down. I saw grasslands.
So volunteering, oh my gosh, volunteering was absolutely fun. I wish we had more opportunities to volunteer. We went twice to this organization called Once in Spain. Essentially, it's a summer camp for teenagers with who are visually impaired. And so they go there, and essentially it's for practicing English. That's what it is. So our purpose there was literally just to go and talk to the kids, talk in English, because they understood a pretty great deal of English. So we were just kind of there to have conversation, get used to speaking the language with us, and it was awesome. I mean, the stories they had to tell, the jokes that they have, you know how summer camps are, they're all there together and teenagers, and it's just really, we had a really good time just talking with them and being there, and learning from them too. It was oftentimes when you volunteer and you think it's just you helping someone else, but sometimes you fail to see the impact that person makes on you, which is just as important, if not more. So, and I'll touch on that later with my reflection just about my whole experience here, but it was beautiful. I couldn't get enough of it, and I would love to go back as soon as possible. So it was a great time, and we have a picture with one of the groups of kids that we were with. I couldn't find our other group, our first group, but it was fun. One of the kids there, he was really into physics, and I love to read about astrophysics. I don't not too many other physics I'll look at, but I love astrophysics. So I was kind of telling him some interesting facts just about space and neutrinos, etc. Just some pretty cool stuff, and it was really fun. So yeah, again, Spain, I'll be back.
She waves her hands as she plays with the air, going out into the forest. Deer and flower await her arrival, embrace on the elements. She magnifies the love in.
So free time. So I want to talk a little bit about the places we traveled to. There were a lot of group excursions that our coordinator planned for us. Also, sometimes in the group we would just break off from the other fellows, and go to a place of our own. I didn't take too many pictures of the food, but I will talk a little bit about the ones I do have. Also, I will talk about some of the things I did when I wasn't doing those things. So, in regards to travel, of course, our coordinator the first few days, she toured us around Pontevedra. That's her home. She's from there, Fatima, our coordinator. Beautiful city, about a 30-minute walk across the entire city, and I really love that lifestyle. You walk to get your groceries, walk to go shopping. You just walk for the heck of it. You'll see whole families out at 12 a.m. just walking, it's just kind of the life there, and it's really nice. Also, you'll see a picture of us at Santiago de Compostela, which is the capital of the region of Galicia, and it's actually where people make their pilgrimages to, because it's the alleged burial site of the Apostle St. James. So, you'll see there in a picture with some of the pilgrims. They allowed us to take a picture with them, and they're actually from the States as well. And it was just, you kind of felt like you were part of an emotional experience. There were a lot of people crying and just, overwhelmed that they finally made it there from their long journey, and it was beautiful. Also, you're gonna see pictures of the Cius Islands, just beautiful islands, crystal blue water. You're gonna see some pictures. You're actually gonna see a picture of my coordinator Fatima in one of the photos there. Also, we went to Porto, Portugal. Me and 7 of the other fellows, we planned a trip there where we went to these beautiful lagoons. We went hiking. I also even went surfing, which was a really cool experience. So hopefully you enjoyed those photos there. In regards to the food, I'm vegetarian, so I didn't get to try the amazing fish that everyone was talking about, but the food was good. I had some arepas, paella, crepes. They were really good. The wine was amazing. Everywhere we went, the wine was amazing. Definitely after this trip, I realized I'm definitely a red wine guy. But we actually, our coordinator, we were able to do wine testing as well, or wine tasting. Sorry, we went kayaking, so a lot of neat things there. And honestly, outside of that, it doesn't. Oh, also I forgot to mention we went to the beach, of course, as well on our weekends. If we didn't, we were just relaxing, we might go to the beach. And I think I have a picture there with my friend Heather. Just beautiful beach, very good place to relax. Outside of that, you kind of feel like there wasn't any time almost. Like, I felt like we were always moving, with a month there, you just try to get in all that you can. So, didn't sleep much. I would go running occasionally. I try to meditate a lot, if not every morning, every other morning. It is something beautiful about kind of being with your own presence and kind of just feeling your presence on earth. I think it's an important thing, and it's especially important when you're going to healthcare. It's important to nurture yourself so you're able to nurture others the way you want to. And so this trip I was also doing a lot of that. But yeah, I hope you enjoy the photos.
Reach down deep into your core and run full speed through those open doors. Dive into her, into him. The total of it all, which is love. Dance while you're naked and bare, but don't stop to compare the movements.
So we're here.
Caroline, these are so good of you.
We're just here with the birds, honestly.
Yeah, I was being
It's beautiful.
with the birds and
It's
plants.
beautiful. Yeah. This is how life should be.
Do this program.
Bend. Sister, feel the energy you send. All together, all in one. See, there is no true separation. Red fire, realization. Stay on this path of liberation. Immerse in this pool, revel in this worthy climb. Let go of your rule and treasure this worthy find. Immerse in this pool, revel in this worthy climb. Let go of your rule and treasure this worthy find. If you are hard in the heart, I say, be ready to surrender. Watch the beauty of the mend, like soul move with graceful dexterity. Move from so low to so high. Love is the bridge between earth and sky. I know that.
So now I'm going to talk about a patient that I met while in the pulmonology department with Dr. Adolfo. She's 16 and she has cystic fibrosis. And it's a very debilitating disease. It's an inherited disease where there's a mutation in your chloride pump, essentially, your chloride channel that makes it so that it can't work properly. And why is this such a problem is because think of your airway. This chloride channel is essential in creating that saline layer that lines the airway, that allows your cells to keep pulling up that mucus, so if you have any, you can cough it up. Essentially cleans the airway, and without it, this mucus simply builds. It doesn't go anywhere. It builds and it gets thick, and it's a problem enough already with having to breathe with this, but the real problem comes in with infection from several bacteria, and it's hard to treat because these medicines not only have to penetrate your mucus, they also have to penetrate these very thick capsules of this bacteria that are now encased in this mucus. So, it causes inflammation, etc. It's very hard on the lungs. Also, in regards to your digestive tract, it blocks ducts. One of those ducts is to your pancreas. So because your pancreas can't now get those digestive enzymes to your small intestine, you're not able to absorb fats and proteins like you're supposed to. So another problem is gaining weight. You suffer from malnutrition, and it's very debilitating, and patients don't have a very long life expectancy. When I met this patient, Dr. Adolfo told me, afterwards, like the life expectancy, she was in a pretty bad shape when I was there, and he was saying maybe 2 more years unless they can get this lung transplant, which then may only provide her with 5 or 10 more years of life. And it was just a really sad thing to hear. Like, I'm in clinical lab science, my major. We talk a big deal of what we talk about is this mutation or this disease, cystic fibrosis. And part of our job is to do sweat chloride testing, etc., analyze the fluids from these patients to diagnose. And we hear about these things, but then seeing a patient that young, suffering from disease, it really gets to you. And I was with this patient for 4 days because I was with Dr. Adolfo this week, and every day, I'd be there, I'd say hey, etc. But it's like I wanted to say more. I felt guilty for leaving almost. I really didn't want to leave, I was like, no, like what's gonna happen to her? She's gonna be okay. And so, the day before my last day in the department, I wrote a letter, because I feel like I just had a lot of things to say, but I didn't know yet what it was. It's hard to explain. It's like my spirit felt what I was going to say before it got to my mind, so I could formulate the words as we kept going to her and meeting her. And so the night before my last day with her, I wrote a very long letter to her, and I translated it in Spanish so I could read it to her that next day, because I wanted her to know how special she was to me. Because she was very special. She's the type of girl, you look into her eyes and you see her soul, and her soul's so strong. It's so strong, and I had so much to learn from her, from just being in her presence, honestly. And it was hard to put it into words. And I was trying to essentially tell her this, and tell her how I thought, like you're literally an angel. Like, we're here in the the medical field, trying to be a doctor, we want to be a doctor because we want to help others. We want to have that ability to bring comfort, to bring healing, whether it be physical, mental, spiritual even. And I was like, we try so hard, but you save more people than a doctor could ever. by just being here. And because you pick up on her spirit is so strong, yet her body fails her, but her spirit just keeps pushing, and it was just beautiful. It's inspiring. It just makes you think like a lot of people are alive, but are they living? It's that type of feeling. You just feel obligated to live your life in a way that honors those that can't live it that way. All I could keep thinking back to was when I was 16, I wasn't the least worried about this. I was worried about sports, high school, and whatnot, and this person's here beside me, just, wondering if she can live the next day, so to speak. So it was quite an emotional experience. And I was reading this to her, I held her hand, and I asked Dr. Adolfo if I could talk to her, once he left, or once he was done asking her about just screening her. So I say this, and I try to keep it together during reading this letter. I really do. But tears started to fall. I still held it together well enough, but her mom just started breaking down. And, it was a very just emotional experience, because I don't think she realized how much, like, her daughter meant to other people. How much her daughter does for other people just by us being in her presence. So I embraced her mom, embraced her, and we left. I told her it was my last day here. It was really sad to have to go, and we left, and I couldn't hold it together anymore. I just started bawling. And Dr. Adolfo was with me. He just kind of talking to me like, yes, Christian. He said, understand, he's like, patients like, so-and-so, they really make you look deeper into yourself. And it was just kind of having that revelation it was beautiful. It was also sad, but it was beautiful. So this was my last day with him, so I actually stayed for a long time. I missed the buses, so he took me home, and that's when he was saying, like, please come on, like, the trip with me. I'm taking my vacation and so. And so that was that, for that week. The next week, however, we went on an excursion, and there was a souvenir shop. So there were these bracelets. And so I got a bracelet, and I was like, you know what, I'm going to get her a bracelet as well, because I want to. Like I said, after being with a patient so long, you kind of feel guilty for leaving almost. And so I got her this bracelet, and I visited her the second week. So I asked Adolfo, who was there, if I could go, say hey to her, ask how things were. And I went, and her parents embraced me. We were all kind of talking as much as I could. Again, Spanish very broken. And I handed her this bracelet that you're going to see in the next picture. And I was just telling her, and what I do when I'm trying to when I want to speak to them, essentially what I do is the night before, sometimes the morning of, if we're being honest, I'll write a lot of things that I think I might say, or that I'll have to respond to on my phone, because I had no service in the hospital. I had no service pretty much throughout Spain, except in the dorm with Wi-Fi. So I would say like, has ganado más kilogramos, or, ask how you're doing, are you gaining weight, how's the treatment, etc. And so this bracelet, I brought it and told her, I know I have to leave at the end of this fellowship, but as long as you have this bracelet, I'm here watching, and you're with me too. I know most of her life has been confined to this hospital, so wherever I go, I want her to know that she's going there too. If I go to the beach, she's going to the beach. And so we kind of shared that, and afterwards, I went. I had to go to my next apartment the next week, and I come back later that week, and she has this gift for me. And you can see it below. It's really nice pen, and she had a very precious note, essentially saying, you're going to be a great doctor. Thank you so much for your support. I wish you the best in life, a hug and things of that sort. Just really precious. And they were telling me that they've been looking for me. They were asking Adolfo for me all week, but that they couldn't get to me. And I was telling them, I'm sorry, this is the department urologist is keeping me really busy, but I promised them since next week is my last week, I'd be there every day. So that last week, I went to her every day after my surgery, just kind of talked, asked how she was, how she was feeling. And one day I missed the bus because we were talking, so I was going to catch the next one, but her family came down, or her parents. They were going out to eat, and so they saw me, and so they took me home. It was funny because they speak very little English. I speak very broken Spanish, but somehow we made it to my house still without GPS, and it was really nice to see her parents again and just kind of I'm just kind of be with them. They're like treating me like family, and I'm like, we've only known each other for so long. It was just beautiful. So that was kind of my spiel about that. At the end of the day, they asked to take a picture, my last day there, and of course we all hugged each other and everything. I was really sad I had to go, but I told them, as soon as I have enough money, I'm going back, right back to Spain, right back. So, yeah, I'm very grateful for my time there, and I feel like it was meant for, me to be there in that place at that time, because it's made me grow so much. I hope I spread my love, my positivity, my energy, but receiving that was just, it was just beautiful. It was just beautiful. So I'm gonna stop talking. That's my note on this patient. And of course I can tell you more. I have pictures. They took pictures and sent to me. Of course I'm not gonna post them, HIPAA, etc. But if you all want to talk about it, I'd love to. But yeah, other than that, it's on to the reflection. So now we're at the reflections, finally, and I'm just gonna go ahead and answer these for each bullet point. So, reflections about important, impactful events. I think when I was talking about the patient there, it's probably the most important event, and I could probably answer that question there. I would say also just seeing the doctor-patient, relationship, which I'll talk on in the next bullet point. But just that, and also meeting people, that was a very, impactful event in itself. Just, the type of, I guess, love that was exchanged that, you don't always find here in the States. It was pretty cool. So I'll talk about that as well. So reflections on the value and skills gained and how those will be used in your future. So, like I said before, the doctor-patient relationship was I think it's important for everyone to see that goes into healthcare. I know I'll carry everything I've learned from this experience on into my career. The patients and doctors here, it's not that I don't think they're close in the States, but I just guess in Spain you're kind of operating on a whole different level of affection, and I'm myself, I'm already a very affectionate person, so it kind of just felt like home, like hugging your patient, kisses on the cheeks, just like, and it's not even like you greet people, you greet women greet women, kissing on the cheeks, but it's not even really a kissing on the cheeks. It's just I'm putting my face against your face because I want to feel your skin in kind of a closeness type way. And this is how it was for, the patients there. It was for everyone I met there, honestly. So just being in a place where your heart can be free like that, it's a beautiful thing. Like I said, I'll say time and time again, I tell my friends, like, I fell in love with the city, I fell in love with the people and the patients, and honestly, I fell in love with myself all over again, because, allowing yourself to be free, just kind of, and, others doing the same, it's a beautiful thing. So I'll definitely use that also, for my developmental growth, of course. In terms of professional growth, again, all this knowledge I learned in the hospital was amazing. Even Adolfo, he would talk to me a lot about his research and gave me one of his papers to read. And I told him I'd email one of mine that we just submitted as well. But he would also tell me about just kind of his daily life. Like, hey, like I do this, I was like, doctors, we live a very, just kind of, nice life. This is kind of how he put it, we do this, we work with our patients during the day. I might go home, do a little research until this time. And then on my weekends, I enjoy my wife and such and such. And it was really nice to hear. But he told me a lot also about his meetings with researchers and how he kind of serves as that liaison between, the patient and also the medicine. So that was pretty cool to see. So I'll go to my next bullet point, overall reflection of the entire experience. Well, this experience is literally, if not the best, it's certainly one of the best experiences of my life. I'm thinking on this one because I feel like I explained this a bit in the second bullet point, but when you're here, it's being in an environment like Pontevedra where you can allow yourself to be how you want to be for people, not only in the hospital but just with day-to-day people that reciprocate that energy. It's beautiful because you don't see it. It's not as common here, not that people aren't like as nice per se, but it's just a different type of relationship, different type of energy you get there, and it's really nice. But the experience as a whole, the traveling was amazing. The food, the experience, the hospital was amazing. All the patients that I've seen, talking to them, hearing about their days, hearing about, what their lives are like in Pontevedra, telling them what mine is like back here. It was a beautiful experience, and I'm so thrilled I went. Like this, you guys really came through on this one. But yeah, I had a blast, and I intend to go back. My coordinator, she said if I ever needed housing, to let her know if I wanted to return. And I was like, as soon as I get enough money, I'm going back. It was that great. So thank you all so much again. And again, I just want to say, UNC Center for Global Initiatives, thank you so much for this opportunity. Literally saying thank you, it doesn't express the amount of gratitude I have for you all. Brandy, Katie, Iman, I know those are the ones I got to see face to face, but if there's anyone behind the works as well, thank you so much. And honestly, this was life-changing, and I can't wait to see all of you and tell you guys more about it in person. But you guys rock. Thank you so much again.